Hi, Mr. Smith. I'm Tina DeCincio. I'm a nurse here at Georgian College. Today I'll be inserting your NG tube as ordered by your doctor. Okay, before getting started, I just have to double check your identification. Could you tell me your first and last name, please?
John Smith,
And your birthday?
June 17th, 1969.
Perfect. And I'm just going to double check with your bracelet here.
Sectioning can lead to...
And the numbers match up. Perfect. Thank you very much.
Before starting, remember to do hand hygiene. You're going to be gathering all equipment at bedside. You're going to be placing your patient in high Fowler's position. You're going to place a towel across the patient's chest and have the MSS basin in reach. If you're right-handed, stand on the right side of the patient. Ask a patient to occlude one nostril and to breathe to determine which nostril has greater airflow. The tube will pass through the nostril that is most patent. In order to measure the length to insert the tube, you need to first measure the distance from the tip of the patient's nose to the earlobe.
Do I need to be getting this guy's head in because we're not?
And then from the earlobe to the xiphoid process.
Okay, so...
Mark the required length with a piece of tape.
Wrap 10 to 15 centimeters of the end of the tube around your hand to decrease any stiffness. Lubricate 7.5 to 10 centimeters of the tube with lubricant or sterile water.
Okay, so if you feel any pain or discomfort while I'm inserting the tube, I'll just get you to raise your hand and I'll note stop. Also, before we start, I'll just get you to tilt your head back against the pillow.
Insert the tube through the nares with the curved end pointing down. Continue to insert the tube and apply gentle pressure if there is resistance, or try rotating the tube. If it does not advance, withdraw the tube and let the client rest and re-lubricate and insert into the other nares. Stop inserting the tube as soon as you pass the nasopharynx. Let the client relax and offer tissues. Next, explain to the patient that they must swallow small sips of water to help ease the passage of the nasogastric tube into the esophagus. While the tube is located above the oropharynx, ask the client to flex their head forward. Instruct the client to take a sip of water and swallow. With each swallow, advance the tube 2.5 to 5 centimeters. If the client is required nothing by mouth, instruct them to dry swallow or suck air through a straw. If the client does not appear to be coughing or gagging, continue to insert the tube until the tape is reached on the tube. To verify the patient's tube placement, aspirate a small amount of gastric content. Assess for color, which is normally cloudy and green, and measure the pH with the pH strips, which should be 4 or less. If the pH measures at 5.5 or higher, it could indicate that the tube was placed in the respiratory tract. The facility may also require a chest x-ray to verify placement. Once tube placement is verified, anchor the tube to the nose using the split piece of tape.
Open the suction care catheter. Use a sterile drape. Do not allow extension. Unsterile. Unwrap or open the sterile basin and place it to the bed. Yeah, that's all.
Connect the tube to a drainage bag or suction. Ensure to mark where the tube exits the nose. This is to be used as a guide to indicate when the tube has moved.
Where is it going to go? I would just say because of stimulation.
Anchor the tube to the patient's gown, ensuring that there is slack to prevent any displacement or tugging. Remove your gloves and then wash your hands. The head of the bed should also remain elevated at 30 degrees to prevent reflux or irritation from the tube.